Saskatchewan Premier Scott Moe is doubling down on his opposition to lockdowns.
Omicron is spreading across Canada and spreading around the world regardless of the public health measures that are in place, which is why we have chosen to avoid increasing those public health measures and increasing the policies surrounding lockdowns here in Saskatchewan. We are not going to impose additional restrictions that cause significant harm for no significant benefit.
Well, he's not alone in wanting to shift gears on how to deal with COVID-19. Spain, Portugal, the UK are all looking at treating the virus as endemic from this point onward. Dr. Monica Gandhi is an infectious diseases specialist at the University of California, San Francisco. So, Doctor, thank you so much for taking time for us.
Thank you.
Is treating COVID-19 like an endemic disease a viable policy decision at this point?
Yes, it really does make sense in all countries once the Omicron surge subsides, which is happening in multiple places, because the idea that we can eradicate COVID, I think, is one that's completely receding from our public view. And you can't eradicate it, but we've done, especially in Canada, what we needed to do, which was take away most of the severe illness through mass vaccination programs. And then for those who are still susceptible to severe illness, we now have therapeutics like Paxlovid was just approved there in Canada. So putting those two together, vaccine and therapeutics, allow you to live with the virus.
Once the Omicron surge subsides, I think is a key part of what you said there, and we need to underline that. The other issue is that there are still many people, for example, children under the age of 5 and other vulnerable populations who have not been fully vaccinated. So would switching to an endemic style of thinking and of acting put them at an increased risk?
So the thing about children under 5, and this is just particular to COVID, is that they're at very low risk for COVID severe disease. It's just part of its epidemiology. It's part of its risk profile. Why is that? Because there are a couple of reasons about their innate immune response and also about the number of receptors that they carry to bring in the virus, that this doesn't affect the extremes of age like many other viruses do. Children under 5 are very low risk. So even though the vaccine is being worked on, that isn't a particularly susceptible population at all. Other populations that are more susceptible to severe breakthroughs are adults with immunocompromise or much older adults with 4 or more comorbidities per the CDC here. And that's where we need to pull out our therapeutics, monoclonal antibodies, Paxlovid, Molnupiravir, to ensure that they do not get sick with therapeutics.
Can we just look at one of the countries we listed there, whichever one you'd like to, what they showed and where they were at in their fight to be able to shift safely, in your view, to that endemic style of dealing with COVID?
So, for example, Spain and Portugal were both at about an 87 to 90% vaccination rate. And the UK also switched at not as high of a vaccination rate, but also had a lot of Omicron-induced immunity. So let's just say essentially they had everyone put together had very high vaccination rates. And you're right that when they switched to endemic, they essentially stopped mask mandates, stopped children masking, stopped vaccine passports, stopped self-isolation or the requirement for that, and stopped asymptomatic testing and went to treating it like influenza, which is really vaccines and therapeutics.
You know, yesterday on the show, we spoke about another issue, a couple of doctors on the program to talk about that, the issue of vaccine equity, and both of them emphasized that this pandemic is not over. We can't think of it as endemic until the world is vaccinated, because new variants will emerge until, more people around the world are vaccinated. What's your take on that part of it?
So I completely agree with that in the sense that you can have endemic states in different regions. So the US or Canada can be endemic, but to avoid future variants, it is, and also just morally and ethically, we need to get the world vaccinated. There's simply no question about that. Omicron itself is causing about 50% of the population, at least by some estimates, to see the virus. And that, for example, in South Africa, they had a 25% vaccination rate, but about an 80% seroprevalence rate. So seeing the virus itself also gives natural immunity, but it doesn't mean that we're off the hook in terms of getting the world vaccinated.
As much as, all of us want to move on and see a future post-pandemic, we've also kind of been in this for so long now. It also feels, frankly, risky. So what can we do? What should governments do as they go down this route eventually to make sure this is done responsibly?
So I think two things. Before we would manage RSV, influenza, parainfluenza, all the other endemic viruses sort of with vaccines, and we didn't have great therapeutics. Here again, we have better vaccines, better therapeutics. But I think two things will come into play to manage all respiratory pathogens from now on. I think an emphasis on ventilation in indoor spaces. A country like yours will need actually manual ventilation during the winter. But I think ventilation in and of itself is an incredibly important thing to come out of this pandemic as a widespread measure for all respiratory pathogens. And the second is that those who are vulnerable to getting those severe breakthroughs, infections, immunocompromised should likely be recommended to wear in the winter for respiratory pathogens, good masks. And I mean fit and filtered masks in mixed indoor spaces. Masking and ventilation, not universal masking, but selected masking for those who are vulnerable, and ventilation should be added to our respiratory pathogen fight.
Where you are in the United States, you've seen how difficult the pandemic has been, how different it is state to state, the controversies about just even believing that it is a real and serious issue, and also divisiveness over vaccines. And we certainly have conversations and controversy in this country as well. But based on what you're seeing there, are you concerned that sometimes people pick and choose the information that they want to hear, or people extract information and disseminate it as part of misinformation, actually? Are you worried that as people hear parts of your conversation, it will allow them to sort of just reinforce that idea that this is not that serious, we'll be out of this pretty soon?
I think the difference between saying this ever before now and now is that we have very powerful vaccines. And second, and I think this is important, is that Omicron led to probably a lot more immunity in the world for those who had declined vaccination, for example. It is a different variant. It is very transmissible. It is less virulent, and it has caused a lot of immunity. It is scary to contemplate that we have to live with this virus, but we do have to live with this virus. And there are other diseases that have been set back as a result of lockdowns. And that means HIV and malaria and tuberculosis and childhood vaccination and schools and mental illness, loneliness, depression, everything else. We have to put this in context with everything else in society. We can live with this, but we will be heightened vigilance for all respiratory pathogens from now on. But we have the tools to do this.
Dr. Monica Gandhi, I really appreciate your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.